Mitral stenosis with mitral regurgitation, mixed mitral valve disease. Instruction by the examiner. Examine the CVS or palpate the precordium. What are your findings? What are the possibilities? Palpate and auscultate the precordium. What are your findings? What are the possibilities? In mixed valvular lesion, usual question is what is the dominant lesion? Now presentation of case number 1, predominant mitral stenosis. Pulse is 88 beat per minute, low in volume, normal rhythm and character, JBP normal, BP 115/60 mm mercury. On inspection, visible cardiac impulse in mitral area. On palpation, apex beat in left intercostal space, centimeter from midline, tapping in nature, frill present in apical area, both systolic and diastolic. On auscultation, first heart sound loud in mitral area, normal in other areas. Second heart sound normal in all areas. There is mid-diastolic murmur in mitral area. There is also a pansystolic murmur in mitral area which radiates to left axilla. Opening snap is present. Mention if any. So my diagnosis is mitral stenosis with mitral regurgitation, mixed mitral valve disease. Now what is the predominant lesion and why? Predominant lesion is mitral stenosis because pulse is low volume, apex beat is tapping in nature and not shifted. First heart sound is loud. What are the findings if MR is predominant? If MR is predominant, pulse normal volume, apex beat shifted and thrusting in nature, first heart sound soft or absent, third heart sound may be present. What is the cause of mixed MS and MR? Chronic rheumatic heart disease. Now presentation of case number 2, where is predominant MR? Present as in case number 1, except the following: pulse is normal in volume, apex beat shifted and thrusting in nature, first heart sound is soft, there is also third heart sound. My diagnosis is mitral regurgitation with mitral stenosis, mixed mitral valve disease. What is the predominant lesion and why? Predominant lesion is mitral regurgitation for reasons above. What happens if MS is predominant? What investigations do you suggest? I will suggest chest X-ray, PAView, ECG, echocardiogram, preferably colored Doppler, cardiac catheterization in some cases. Now, occasionally difficulty arises when the patient has loud first heart sound and apex beat is also displaced. In such cases, you should say that it is difficult to be sure clinically about the dominant lesion. Echocardiography is necessary. Now, endocarditis is common in which lesion? MR or MS? Endocarditis is common in mitral regurgitation. How to treat mixed MS and MR? As follows: mild and asymptomatic follow-up is needed. Periodic echocardiography should be done. Drugs such as diuretics, prophylactic penicillin to prevent endocarditis. In severe and symptomatic case, valve replacement is required.